Hello, my name is Esther Hyun, and today I will be discussing the use of Leqembi as a clinical intervention for Alzheimer's disease. As of July 6, 2023, Leqembi is the first traditionally FDA-approved amyloid beta-directed IgG1 monoclonal antibody treatment for Alzheimer's. Alzheimer's is a topic that's very near and dear to my heart, and I'm excited to see this advancement in clinical research. To preface, Alzheimer's disease is characterized by various molecular and cellular changes, including the buildup of plaque, amyloid plaque to be specific, the presence of neurofibrillary tau tangles, chronic inflammation, vascular factors, and loss of neuronal connections with eventual cell death. The purpose of this video project will focus on how Leqembi targets the buildup of amyloid plaque. It's also important to consider that Leqembi does not cure Alzheimer's disease or related cognitive deficits. Rather, it is the first drug to show clinical benefit and influence a slower progression of early-stage Alzheimer's disease. The picture below shows amyloid PET imaging using FFDG and F-fluorobutadiene to essentially light up the amyloid plaque. And here you can see the significant difference in amyloid plaque between a normal patient and a patient with Alzheimer's disease. Before I discuss the purpose and significance of Leqembi, I'd like to explain what amyloid plaque is. Amyloid plaque is made up of strings of protein called beta amyloid that clump together. This beta amyloid comes from a larger protein called APP, or amyloid precursor protein, which is found in the fatty membrane surrounding nerve cells. APP is made of 771 amino acids and is cleaved by two enzymes to create beta amyloid pieces that are made up of 38, 40, or 42 amino acids. The structure of beta amyloid depends on how many acids it contains. For example, beta amyloid 42 is made up of 42 amino acids, and this is quite toxic and much more common in patients with Alzheimer's compared to other types of dementia, including frontotemporal or vascular. It's important to consider that the presence of plaque can impair cell function and eventually cause cell death. Some hypothesize that beta amyloid can also influence the release of free radicals that attack neurons. Now, what is Leqembi? Leqembi is an antibody that is designed to bind to and neutralize a soluble toxic version of this beta amyloid. By tagging the beta amyloid protein, it helps the body's immune system mark it and help clear it out of the system before it can reach toxic levels and ultimately prevent this clumping or aggregation. The dosage of Leqembi is a diluted solution that's 10 milligrams per kilograms that's administered through IV for 1 hour once every 2 weeks. Interestingly, the updated data shows that subcutaneous injections are actually more effective in reducing the amount of amyloid plaque, and there was also reduced site-related infections or irritation. Alternatively, with new medication, it's important to consider the contraindications. For example, about 2 out of 10 people who receive Leqembi can develop something called ARIA, or amyloid-related imaging abnormalities, which can cause cerebral hemorrhaging and or edema. Therefore, patients who are candidates for Leqembi should undergo genetic testing for something called APOE4, or apolipoprotein E. Also, this type of treatment is contraindicated in those who are experiencing issues with anticoagulation, because this can increase the risk of brain bleeding. This isn't to say that a patient is automatically excluded, but it is important to discuss this with your provider.